Hello and welcome to the Eye Safety Card staff training video. My name is Stanley Keys. I'm a hospital optometrist based in Scotland, and I'm the developer of the Eye Safety Card and the optometry support website Optometry-evolution.com. So what is the purpose of the Eye Safety Card? It is really designed to help practice support staff to be alert to certain signs and symptoms which patients may present with, which may indicate that they've got something quite serious happening with their eye. So for example, a painful red eye or a sudden loss of vision or flashing lights and floaters, all of these things could indicate that there's really some form of eye emergency in this patient's case. Now often the support staff are the first point of contact for patients, whether it's the patient phoning up to complain of a difficulty they're having or whether they present to the practice. So it's really important if support staff are alert to these signs and symptoms so that they recognise them as being something quite significant and something which needs to be reviewed urgently, rather than maybe being appointed a week or 10 days later. So the card will increase awareness of these conditions and it will give you some guidance as to what to do in these situations. The eye safety card was primarily designed to be used in optometry practice, but since then it's found an important use in GP surgeries and ophthalmology departments in a similar way to alert support staff to certain red flag signs and symptoms. It's also found a place in pharmacy practice, as pharmacists are often presented with patients with red eyes and uncomfortable eyes, so it helps them to suss out which ones are perhaps the more serious ones. Similarly in A&E departments. But it has also found a use in care homes and nursing homes, because often these more serious eye conditions affect the elderly, so it's really important for care staff in these settings to be alert to certain signs and symptoms for their patients and residents. This is what the eye safety card looks like. It's a double-sided A4 card made in quite sort of heavy laminate card, and this is the front surface. It's designed really to be kept in a prominent position within your practice, so near the reception desk telephone, for example, so where the main point of contact is with patients, so it can be referred to readily. And having several throughout the practice is useful, even in the consulting room, just as a little reminder. As you can see in the card, there are three main categories on the front, so painful red eye, ocular injury, sudden loss of vision. And the idea is that there's just a quick description given of some of the conditions and emergency situations which can give rise to these symptoms. So if a patient comes along with a painful red eye, for example, just highlight some of the important conditions that can cause that and hopefully press home the urgency with which that maybe needs to be reviewed. So if you turn the card over, this is the rear surface of the card. Again, we've got three different categories. The first one being flashing lights and floaters. Second one is distorted stroke blurred central vision. And finally, just a miscellaneous sort of category with some other symptoms which can arise. And once again, there's just examples and a little bit of chat about each of these symptoms. So we will now just have a look at each of these categories in turn and just give you some of the information which is on the card. So the first one is painful red eye. Now, a lot of patients present with red eyes or slightly uncomfortable eyes. In general, if an eye is really quite sore and painful and very sensitive to light, for example, then those sorts of things should just raise a little alarm bell and say there's perhaps something a little bit more serious to this and this patient needs to be seen. If they mention, for example, anything else in their history, like maybe an injury, that they wear contact lenses, they've had a recent operation, for example, for maybe cataract surgery or glaucoma, again, any of these things just increase the risk of this being something quite serious. And a red painful eye could be caused by something, like an ulcer of the eye. And again, contact lens wearers might be a little bit more prone to this. Could be an infection or could be an inflammation within the eye, which can cause damage to the eye. So any of these sorts of symptoms, really pain, something very sort of sensitive to light, and any of these other risk areas should really be seen on an urgent basis. The next category is that of ocular injury. Now, no two ocular injuries are ever the same, but there's a few different sort of broad categories and causes of injury. Probably the most common type is a foreign body, so maybe a little bit of stone, as in the picture here, or a bit of metal, perhaps a mechanic hammering metal is quite a common one. Chemical injuries can be very dangerous, so a liquid or a powder in the eye, particularly if it's alkaline, these patients need very urgent first aid to the eye in terms of rinsing out with saline. A blunt trauma, maybe in sports or from a punch or something, for example, can really cause damage to the eye. Obviously, a penetrating injury with a sharp object can be incredibly dangerous. And also, an abrasion is quite a common type of injury, perhaps a contact lens wearer, or maybe a young child with a fingernail in mum or dad's eye, for example. Any of these are going to be painful and pose a risk to the health of the eye, so really they all need to be seen on an urgent basis. Next is when patients complain of a sudden loss of vision. So really, a significant loss of vision over a short period of time is what we're thinking of here, because generally that would be caused by something really quite significant, whether it's just a problem with the eye, such as wet macular degeneration, or a problem with the optic nerve, or some form of retinal detachment, for example, or maybe a problem which indicates that the patient actually has some significant health problem. So, for example, if one of the blood vessels at the back of the eye gets blocked and that causes the reduced vision, there's also something seriously wrong with the general health of the patient, also. So, any patient with a sudden and significant sort of loss in vision really needs to be investigated very promptly indeed to try to establish what the underlying cause is. So when you turn the card over, the first category you see is flashing lights and floaters. Now, when a patient comes along reporting that they've had a recent episode of flashing lights and floaters and possibly a change in the vision as well, for example, then the main thing that we're worried about is the possibility that they're having a detachment of the retina or a tear of the retina, which could lead to a detachment, as this could cause very significant long-term damage to the vision. Now, the key with a retinal detachment, as with a lot of things in eye care, is detecting the problem early, as it may well be treatable. So anybody reporting these classic symptoms, flashing lights, an increase in the floaters, maybe a shadow or a change in the vision, and particularly if that person's myopic, then really you have to think along the lines of potentially a retinal detachment. And so it needs very early examination to see if that is the case, in which case treatment would be sought. The next category on this side of the card is distorted central vision. If a patient presents saying that they've got quite a recent onset of distorted vision centrally and perhaps difficulty reading and words and things looking blurred or face recognition becoming difficult, we are a little bit concerned that there's something happening with the macula at the back of the eye. The most common thing that can occur is probably wet macular degeneration. And again, like a lot of other conditions, the earlier it is examined and detected, the quicker it can maybe be sent along to an ophthalmology department for treatment, and that gains the best outcome for the patient. So just be alert to anybody reporting distortion in their central vision or describing wavy lines whenever they look at something with a straight edge. It could be something quite serious like wet macular degeneration or other conditions affecting the macula. So finally in the card we've got this other situations category, which just includes some of the other maybe less common situations. These include severe headaches, because often there can be an ocular cause for these, and these patients need to be examined for the health of their eye. Changes with the eyelids, if they become particularly swollen and tender, for example, or maybe start to droop, can suggest that there is maybe a problem. Patients with double vision, particularly if it's a recent onset and really quite definite, particularly young people with this need to be investigated promptly. Unusual lumps and bumps around the eyelids, because sometimes these may be little malignant lesions which need to be looked at with somebody with that particular expertise. Transient loss in vision can almost be like a mini stroke within the eye, so a little blockage of a blood vessel shuts down the vision for a short period of time and then it returns again, but that needs to be investigated. Unequal pupil sizes as well can maybe suggest a neurological problem. So any of these things should really be investigated promptly. So in summary, the idea of the eye safety card is that it is kept in a prominent place when in your practice where it can be referred to easily. So beside the telephone where patients are calling up, or at desks throughout the practice where the sort of points of contact are. So if a patient does come along complaining of one of these sort of red flag situations, you can refer to it easily, and just a little reminder to check if this is something serious that the patient is complaining of. If you feel that it is one of these quite serious situations potentially, then the idea is that you arrange an urgent appointment for them to be seen and make sure that they are not sort of delayed in that. If you're in any doubt whatsoever, speak to the trained member of staff in the practice. So if it's the optometrist or the GP or the ophthalmologist, speak to them and raise whatever the concern is and ask what their guidance and advice would be and the best course of action. The eye safety card is certainly not suggesting, that it should be used for support staff to in any way diagnose these conditions or to be experts in them. It's purely just to sort of sound the alarm bell whenever a patient does complain of one of these symptoms, that it may be something quite serious and needs to be seen on an urgent basis. If you don't have anybody like the optometrist in practice that you can refer to, then give the patient an alternative suggestion. So maybe that they attend their GP or NHS 24 or the sort of equivalent advice line, or in the worst case scenario, if it strikes you as being something really quite serious, then perhaps accident and emergency. Thank you very much for watching the eye safety card staff training video. If you would like to get further information or advice on the use of the eye safety cards, please don't hesitate to get in touch with me through either my email address, stanleykeys1@icloud.com, or through the website, optometry-evolution.com. If you wish to order more cards for your practice or your organisation, again, please don't hesitate to get in contact, and I will try my best to help with that. Okay, thank you very much.